The double needle technique for temporary stabilization of unstable meniscus tears during an all-inside meniscus repair, presented by Dr. Luca Farinelli, Dr. Amit Meena, Dr. Sachin Tapasvi, Dr. Elizabeth Aberman, Dr. Christian Fink, and Dr. Christian Hoser. None of the authors have any conflict of interest related to the present surgical technique. What we present here is an unstable tear of the posterior third of the lateral meniscus. Probing reveals that the tear is extremely unstable and easy fixation with an all-inside device would not be possible. The two key components of this technique include a 17-gauge epidural needle or a 2He needle and a long 21-gauge hypodermic needle. The 21-gauge hypodermic needle can easily pass through the sheath of the 2He needle, and the 15-degree upcurve of the 2He needle allows for easy placement of this hypodermic needle in far to access areas of the meniscus tear. Here, then arthroscopy is performed and then the meniscus tear is carefully reduced. To temporarily stabilize the meniscus tear in its correct position and to avoid the tear from flipping around, a 2He needle is then advanced inside the joint through the appropriate portal. This may be one of the standard portals, or an additional stab incision be made in the skin to allow for correct placement of the same. The 21-gauge hypodermic needle is then advanced to the outer sheath and the meniscus tear is well reduced. Following this, the all-inside device is brought inside the joint through an appropriate portal, and the preferred suture configuration, either a vertical or a horizontal mattress suture, is then deployed to allow for good meniscus repair. The meniscus repair is then compressed and held stably and securely, and then only would you withdraw the 2He needle and thus allow for a good stable repair. The easy reproducibility of the technique and the low cost and effectiveness make this a very useful trick in our day-to-day clinical practice when we are dealing with unstable tears. Ordinarily, one would need to resort to using inside-out needles and using cannulas to try and achieve the same. This technique is a very simple, reproducible, and allows for a good surgical meniscus repair.